all about making sure the janaza is ready for the ghusl. There are two tables in the room. One is the table with the water access, so to give wudu and to give ghusl. The second table is a dry table where we can just take the janaza there and do the shrouding. Before we start with the ghusl, the first step is to make sure you take the clothes from the janaza itself. So there could be somebody who may have a regular dress, a shirt and pant. Or could be somebody who have been in the hospital for a while, they may be hospital gowns. Could be in the freezer for 3-4 days, we have different types of dresses. All along the ghusl process, as Sheikh Adam mentioned, we need to make sure the private parts are completely covered. Entire ghusl thing, you don't want to expose any of these private parts. The private part starts from the upper part of the lower part of the stomach to all the way to the knee. So that part should be always covered. We have extra cloths there in the room. We have the different types of cloths. We have scissors, we have gloves, we have camphor, we have perfumes. Whatever you need to have, that is all in the room over there. You don't need to bring anything for the ghusl. So the first step is to remove the dresses. So take out the dresses. Let's assume you are first, when you are removing the clothes, you have the towels like this. This is used to cover the aura part of it. So when you take out the shirt, when you take out the pants or whatever that lower part of the garment, you always have somebody to take this one and cover it, so the private parts are not visible. Also, when you look before you start doing anything in the ghusl, look around the situation of the body. You cannot apply the same method for everybody. So as I said, there could be somebody's very fragile skin, maybe 90 years, 100 years old. You cannot just rub the body and do the shower, right? There could be somebody who's got a lot of band-aids in the body, so you cannot do the same thing. An average person like who is in 60s, is healthy and all of a sudden passed away, it's no problem. But always look at the situation, look at the janaza and see how we assess the situation and do the ghusl. The first step in doing the pre-ghusl, the first step is to make sure the impurities are taken out from the body. After you undress, after you cover the aura, there could be some impurities in the tummy, so you need to clean them up. The better way to do it is just gently press the tummy. There could be 2 or 3, minimum 3 people is needed, better yet 4, 5 is okay as well, but minimum 3 people are needed. The first step is to just to lift the head a little bit and gently press the tummy, and somebody yells with the water, just, yeah. So you have a warm water, the lukewarm water. It's not either cold water or the warm water. It's lukewarm water. Just go use the gloves to clean the lower part of the janaza, so that all the impurities can be cleaned up and completely washed away. And then you just get the janaza back. We need to start doing the second part of the ghusl is doing a wudu. The first part is making sure the dresses the clothes are taken away, assess the situation, clean the lower part of it, and then start. Second step is to doing the wudu. Wudu is done the exact same way as what you do for yourself, except there could be some scenarios where you don't want to remove some bandages. For example, if somebody has got a bandages, he's assess and see if it is dry, can it be pulled off, or it could be some fresh blood on the skin, then you don't want it to pull it off. You just leave it as it is, do the wudu as normal. So start with the hand as usual, then mouth and rinse, and then nose. You gently put the cotton swabs and go inside and make sure you clean the noses as well. And you do a regular wudu until you wash the head and the feet. And then that's the second step. The third step is to do the full shower for the janaza. You start with the head. We have shampoos. We have the body wash in the room. So you take, as I said, you use the lukewarm water. Start with the head. Gently lift the head. Somebody hold the head, lift a little bit, and cover the lower part of the head with the soap or shampoo, and gently wash the head, and then start washing the body from the right side of it, and then go into the left side. When you start, Good. Yeah, when you start washing the side of the body, right? You need to make sure all the parts are clean, right? So you won't be able to do that without somebody lifting like this. So could be one person here, one person holding the head, one person holding the shoulder, one person holding the leg. Somebody has to lift the body, so you have access to the lower part of it. So you use the soap again, and one person is holding the water, and then just keeping the water on, and then cleaning the whole lower part of it, and then turn back and then do the same thing on the left side as well. Just cover put the soap, put the water, and clean the whole part of it until the leg. So this needs to be done 3 times to make sure the body is fully covered. The third time, what we do is generally, rather than just using the plain water, we have a cups with camphor. We put the warm water there, put the camphor there, make it powder, make it dissolve a little bit, and then use that to just spritz on the body so that it gives some better smell for the janaza. Once the 3 times washing is done, we have the cotton clothes like this to just dry the body. You don't want to just dry like our regular how we do it, but gently rub on it to make sure the body is completely clean and dry before we start going to the third step. So let me pause here and see if you have any questions before we go to the third step.
What was the powder you said?
Camphor.
Camphor.
What is that?
It's kind of like a disinfectant.
Plus, it gives some good smell as well.
Okay.
It's not a perfume.
We'll show you when you go there.
It's a white
I don't know what the
soda.
name in Arabic is.
No worries. Yeah.
The English name is camphor.
Okay.
Kafur. I think in Arabic also it's called kafur.
You have to recite in your dua or
No.
No, there's no requirement.
But you start with Bismillah. I forgot to mention that. You start with Bismillah. But other than that, there are no specific duas to be recited.
You said to do the whole thing 3 times. Is that 3 times in a specific order, or can I just watch the back and turn to the side?
Start with the right side and then go to the left side.
Okay.
First start with the head and then start with the right side cleaning and then go to the left side and repeat the same thing 3 times.
Got it.
What happens if there's autopsy and we can't use water at all? Whether is there any exceptions?
Usually when there's autopsy, the body is already repaired,
Yeah.
so there's already
There's
you won't know
stitches,
there's
yeah.
an autopsy done. It's called autopsy repair, right?
Yeah.
So you can still do that, but again, like Brother Shah, you got to be very gentle.
Good.
Sometimes, I don't want to get into some of the corner cases, right? But some extreme circumstances where there's been, someone has been burnt or someone has been drowned. So it's got to be extremely gentle. You can't even put water, right? So in which case you can just pass cloth over it,
Okay.
and it's done. In fact, during times of COVID, if you were there, right, we couldn't even give the ghusl, right? Because everything was wrapped, so we just had to, the fiqh allows for, things. We don't have to use water, right? So you just have to use the appropriate, thing. And there's always imams. We talk to Sheikh Fazal, and Sheikh Juban, and everyone to get guidance in this extreme circumstances.
During the wuzu, does water have to go inside for gargling? During the wuzu.
Go ahead.
No, you can use, like Brother Shahab, you think mentioned, right?
Yeah.
You can use cotton gauze and just wipe the lips.
Teeth and lips.
And the same thing with nostrils too. Use a cotton gauze and just.
it might not even be able to go in because of what's called rigor mortis. The mouth is all jammed up.
Yeah.
You just have to wipe the lips.
So just it's something.
Yeah, you
Yeah.
won't be able to open them all. You don't want to push too hard.
Yeah,
on
you don't
anything.
do that.
But even if there are cases where the hand is super tight and not able to move, you don't need to just really lift it up to wash everybody. So leave it gently, so it doesn't need to break the bones or take out the wounds or anything like that.
Ears just from the outside, or you get a cotton swab and clean inside the ear, or just
Yes.
outside?
Outside.
Outside only.
Yeah, and then you use the cotton swabs to go around it, the round area, but you don't need to go too deep into that. Okay, so then inshallah the next step is, so let's assume we have two tables. We will use the same table for the shrouding here for the sake of simplicity here. So we have we cut 3 pieces of cloth. three pieces of cloths are one. We actually before we put the three pieces of cloths, we need three pieces of yeah. Pieces of these ones to tie around, and you cut it in a perfect shape. Whatever is available, I just pull it out here from the room. And this needs to be preset before you move the janaza, otherwise it's going to be all messy. So the dry table, you keep three pieces of clothes, and depending on how big the janaza is and how tall the person is, you may want to adjust the size. There's no standard size.
This is the outer garment, the ghilaf, right? This is the outer part. So this is the pant, right? The trouser piece of it. And then that's the shawl is going to put the izar. So that's the covering for the neck.
And throughout this process, you keep the aura covered. So what happens is when you move from one table to another table, the tables have wheels on it, so unlock the wheels, gently move the table next to each other, and then have two people hold the other side, two people hold from this side, one person holding the neck all the time, because necks are not going to be stable, so it's going to fall down. So you gently move from one table. That's why we need 4 or 5 people. And if the person is too heavy, we need more people as well.
Yeah, this is the most labor intensive
Yeah.
piece, to move the person from
One
the table that's used for washing to this dry table.
Yep.
And we'll show you that.
So, as I said, the aura is all time closed. So we have the first one is the izar. So we have an opening for the head. So assume this is the head, and cover all the way here, and then start unfolding this from the right side. So just go it around on the right side.
The way we were taught is like, just like you're doing salah, always.
Oh, yeah, that's a good point. So before you start covering with the clothes, you make sure the hands are joined like this, like as you stand for the salah. So left and top on the right side on the top of the
If possible. If not,
exactly. It's not
Don't force
mandatory. Yeah, if the hands are so stiff, you don't want to break it. You just leave as it is. So you cover from the right and then go over the left and make sure it's fully covered here.
got to make sure it's tucked in nice and tight.
Yep.
It's a very important thing, nice and tight.
And if the excess cloth, so tuck it under the body so it is not loose. That's the first part. The second part is take the second cloth and go over the right, and then go over the left, and then cover from the top. We have extra cloths. It's not usually the case. Yeah, so we have. So usually this is the length we have. So the extra cloth is used for the tying, and then we take this third one. And then we have this is a place to make the tie. And then this one is not necessarily 3, it could be 5 depending on how tall the janaza is. So the intent is to make sure we are able to hold the whole coffin tightly without getting loose. So you tie this up on all 3 sides. Yeah, that's it. So there is one other thing, it's not mandatory, you just apply the perfume. So there are different flavors of that. So some people apply the perfume on the clothes itself, some people apply the perfume on the body. So we have perfumes in the room. Besides putting the camphor, you can apply the perfume as well.
Yeah, one important thing about the ties, when you lower the body in the grave, you have to untie these things, right? So, you just have to untie it, but this is just to kind of like keep the body steady.
Yep.
Right?
Yeah, you just go You don't need to completely remove this one. Just untie it and leave it as it is.
Yeah. So, any questions?
Two questions. So one, did you purposely take off the cloth that was covering the
Yes,
first?
of course, yes. Once the izar covers thing, you don't need that thing. You take it off, right?
Okay.
Because then the aura is all covered with this cloth, right?
And then second, do you put anything in the mouth and the nostrils?
Only if there is blood coming out or something, then you might want to put some cotton gauze or anything. Otherwise, no. Yeah.
Yeah.
Maybe two Nate questions. Like first one is like you mentioned about the hands. Anything specific with legs to keep it like together? Or
Not
There are very odd cases where the legs are going too far apart. So, but when you start putting these clothes up,
When you
tighten it up, it comes together, and then when you use a rope, it comes together. You don't need to specifically tie the toes.
So the tie is not a specific number. In case you need an additional tie for that, you can put an additional tie. I
Exactly.
mean, that's just to support.
Exactly.
Exactly. Yep.
Brother has a question.
Is there a law to leave the face open until family visit and then cover it?
No.
Yeah. See, when we finish the ghusl, everything is tied up. But if there are families comes up later, you can always remove the head part of it and show the face. But as soon as the janazah, unless until the family is right next to the room, you don't need to tie it up right away. They can come and visit and then you tie it up. If they come, let's say 15 minutes later, you can always untie and show them.
Yes.
Let's say once you're done with the istinja and when you're doing the shouting, and you realize that some of the impurities is still not clean, and there's stains left on the shout when you're doing it, do you have to repeat it, or can you just at that point move forward?
So that's a good question. I don't know the answer. We take every care to make sure that everything is clean before we actually put it in the thing. You know. So because especially when there's blood and everything, we want to make sure. That's why we sometimes we use gauze and cover the mouth if there's blood coming, to make sure there's nothing leaks onto the the cloth. Have you encountered? I mean, that's a
No,
good
the
question
only
for,
time we have seen is the blood. We see the stains of blood in the cloth, so you just put some band-aid or put some cotton swab on top of it. We don't take it back and wash it because
wash it,
the
yeah.
blood is not going to stop.
Yeah.
But in terms of impurities, you use the white cloth to clean your the bottom, right? So you will easily
will see.
identify if there are anything left over. So you do extra few steps to make sure it's
Yeah,
completely
that's the
clean.
first step. Like I said, there's a first step is to make sure that all the impurities are out, right? So it's usually someone holds the head, and another person like presses the belly, and another person is cleaning,
As a
the aura to make sure there's nothing. And we use a white cloth, so if there's any brown stains or anything, it's visible.
Yep.
And we do it multiple times and with water to make sure there's absolutely nothing, right? So.
This is why we want the body buried as soon as possible.
That is
These are
correct.
exactly the reason why we want the body buried as much as possible.
That is correct.
So what happens if you don't bring it as soon as possible? What happens then?
They will do what they can as much as because of the death certificate and all, but it's about the intent of what you could do. And once the body is going to be moved and all, and people are going to be left, anything is possible.
Anything. There could be
Allah goes with the intent, inshallah. You do the best you can and leave rest to Allah subhanahu wa ta'ala, inshallah.
Brother, doctor.
Thank you so much for the presentation. At this stage, you mentioned in the talk earlier that sometimes there can be short delays. For example, maybe someone passes after Maghrib and they're not going to be able to have the certificate and or burial until the next day. When this is done, this shrouding is done, I assume this is done right before they are to be buried, right?
Yes.
So you wouldn't do this the night before?
No, we try to not do the washing until we are reasonably confident that the burial is going to be happening, right?
So the shrouding happens, then a janazah is prayed,
Yes,
and then they go
that's
to
a great segue to the next part, right? So once this is done, right, we usually tie it with the salat, one of the farad salat, either Zohar or Asr. We bring the deceased either on the trolley or on a gurney, and the Salatul Janazah performed, right, by one of the imams who is leading. And after the Salatul Janazah, the body is put back on the gurney to be transported. So usually by that time we know, right, that either the burial certificate is imminent, or because they won't let you bury, right, or there's a delay. If there is a delay, if something happens and there's a delay, that's when you have to kind of like make a call. Sometimes it's after everything is done, you have to put that body back overnight in a storage for burial tomorrow. Extreme circumstances, right?
But you wouldn't need to redo anything.
No, we don't need to redo anything because the intent was to bury, and this is just paperwork issue.
So, do you want to say anything about preparing a child's body? You guys are talking about adults, basically.
Yeah.
What happens if there's a child? Is there anything different?
I don't think so.
I mean, again, with a child, all you need is, you don't even need 3 pieces. Just 1 piece of cloth is enough.
Depending on the age and
That's it,
inshallah.
right? Yeah,
Okay.
actually. And then, so I don't want to get into some of the details about fetuses, stillborn, but again, we have fiqhi things. We deal with our imams, but it's very simple. The child's one person. All you need to do is wash, wrap it under a cloth, and go. Right? You don't need salat al-janaza. But you do salat al-janaza.
Inshallah. Thank you. Jazakumullah khair.
Yeah.
If it happens, say after Maghrib or after Isha, so with the deceased, stay at home till the next day?
Yeah, in King County, it's allowed now, right? Previously, it was not allowed. You couldn't keep the body at home. But now you're allowed, if someone passes away in a hospital, you can actually bring the body home and keep the deceased overnight, as long as you're going to bury it the next day. You can do that.
And the next day, what time in the morning? do you
Usually the typical wusuls happen by at 11 o'clock or 11:30. So it's time. It takes about, the whole process takes about an hour, I would say.
Yeah.
Hour and a half, depending upon how many people. So if you start at 11, by 12:30 you're done. And if it's winter time, Zohar Salah is 12:30, you're in time for,
So no need for refrigeration
no,
overnight?
no. Unless it's summer, sometimes you keep ice and all that stuff around the disease if you're keeping it home, but otherwise, yeah. If it's going to be more than a day, then yeah, you need to start thinking about it. Especially, women sisters who pass away. I don't know if you've seen funeral homes. It's very, just boxes, right? And we don't know how the handling is done, so we prefer, especially if it's a woman disease, we say, please take her home, keep her with you, and then next day bring her directly. Previously, King County would not allow that, but now if it's overnight.
Is there an etiquette to something you're supposed to recite while the body's at home?
Not that we know of, no. It is recommended that whoever